Hi, I'm Dr. Gnanam. I am a pediatric intensivist and the pediatric ER head at Manipal Hospital, Bangalore. And I would just like to give all of you an update on dengue in children. So the first thing which I would like to say is please do not panic. It is just a viral infection, and if we recognize it early, we can treat dengue and it's not going to be fatal. So just to tell you what are the symptoms of dengue, it's a viral infection basically which is transmitted by the bite of a mosquito, and we have three phases in this illness. One is called the fever phase, and the second is the leaky phase. The last is the recovery phase. So during the fever phase, the child may have a very high fever, almost touching 103, 104 degree Fahrenheit, and he may have a lot of pain in the eyes, a headache, body pain. Generally, the child will feel very tired and will just want to lie down. There may not be any other associated symptoms like cough or cold to support any other viral diagnosis. So this is followed by another phase called the leaky phase. So once the fever kind of subsides, what happens is that the blood vessels throughout the body, they become a little leaky. The lining of the blood vessels become loose, and so what happens, the water component of the blood kind of comes out of the blood vessel, and so the blood becomes really thick. And when the blood becomes thick, it's just common sense to know that it doesn't flow forward, it remains static in one particular place. And so when this doesn't flow forward, blood supply to all the vital organs is kind of compromised. So this phase is called the leaky phase, and this medical terminology for this state is called shock, and it is a root cause for all the complications in dengue. But fortunately, so this is not to scare you to say that all children will go through this. Fortunately, very few children go through severe leak, and many of them, they just have fever, they may just feel tired and they get better. So we need to be careful, and we need to watch out for certain warning symptoms during the leaky phase, which may be in the form of severe pain in the stomach. The child may be vomiting persistently about 3 or 4 times in a day. The child may feel excessively sleepy, or in infants, they may be very irritable, they may refuse to feed. The hands and feet may turn a little cooler than usual, and the child may not pass adequate urine. So if any of these symptoms are present with fever, then you may have to immediately rush the child to the nearby hospital or to a pediatrician. So this leaky phase fortunately lasts for only about 36 to 48 hours, generally not more than that. So after that, the child becomes really well, and that's called the recovery phase. So the appetite improves, there may be a rash which develops, and the rash may become itchy during this phase. So overall, there's a feeling of well-being. So the total duration of symptoms is generally 7 to 9 days, but every season, every year, the dengue kind of, we kind of wait for 1 or 2 months to see how the presentation is going to alter, and then take it from there. But mostly it lasts for 7 to 9 days, and I would again say that do not worry. Please recognize the symptoms early and do take your child to a pediatrician to allay your fears.